In Chapter 7, we are looking at environmental conditions for athletics in sports. So first we're going to talk about hyperthermia. So hyperthermia is one of the most dangerous illnesses that ATs will face. It is an increase in body temperature, and it's important to understand that heat illness can happen indoors or outdoors and in temperatures that might not even seem too hot. It is something that we always need to be aware and understand that we need to recognize people who are at more of a risk of heat illness and understand the signs and symptoms associated with the different forms of heat illness. All right, so heat stress is exactly what it sounds like. It is the stress that a body experiences when training in intense heat. The body will continue to function normally as it starts to recognize the increase in body temperature and then start the processes that help to dissipate this excess heat. So heat can be dissipated through 4 mechanisms. You have conduction, which is direct contact. So for instance, it'd be like you sitting on a cold surface, such as a bench. That heat is going to be transferred to that surface. Convection is the use of a fan or a mister or a cold tub to transfer that heat. And then you have radiation, which is similar to heat leaving a wood stove. It's generated through energy or metabolism. This usually occurs in temperatures lower than 68 degrees. And then the one that we all know, evaporation, which is when we sweat. All right, so the biggest factor in sweating as a form of heat loss is the humidity in the air. If there is a high humidity, or 75% or higher, sweating is difficult to occur, and many will find that the perspiration that they believe is on their body is actually some of the water from the air. The ability to sweat is very important for heat loss, and there is a point when a person is extremely dehydrated when they are unable to sweat. There is actually a disorder called antihydrosis, which is a person's inability to sweat due to a couple different reasons, including central and peripheral nervous system disorders. And some medications can also affect the anterior hypothalamus, which can cause you to not be able to sweat as well. However, these diseases are very uncommon. Normally they happen in like 1 of 6,000 people, so you aren't really likely to see this in sports. However, it's good to be aware of it. And then an understanding that the dehydration factor is the most likely reason as to why someone might not be able to sweat in the sport. When this happens and a person is unable to produce sweat, hypothermia can happen even in colder weather. All right. So we have heat syncope. It's one of our heat illnesses. It's also referred to as heat collapse. It's one of our milder form of heat illness, which occurs when the blood pools in the extremities, which causes an individual to become very dizzy. They'll have blurry vision and fainting spells. The best way to treat this illness is to lay the individual inside if possible or under shade and elevate their legs to help increase blood flow back to the heart. If accessible, you can also put ice under their necks and then really encourage them to consume fluids if they are conscious. Another milder form of heat illness is heat cramps. This illness is persistent because once you start having heat cramps, you normally don't stop until that activity is done. And so it's very hard for an individual to return to their sport because it's just going to continue happening and oftentimes get worse. Most of the time, this is due to excessive water loss and an electrolyte imbalance in the body. However, there is some debate that there are other causes to heat cramps that you can look up. It's kind of a hot topic in athletic training. With abdominal cramping, it is important to consume fluids at a slower, consistent rate because it can increase cramping due to the rapid ingestions of fluids. All right, so heat exhaustion is diagnosed by a core temperature of about 102 degrees. A key indicator is the profuse sweating and pale skin that could be cool to touch. With this illness, the best treatment is IV replacement in a cool environment. Now, IVs can be, in some states, administered by an athletic trainer under a physician order, and obviously having the proper training. However, more often than not, you'll need EMS to administer an IV. One way you can prepare for this is to have a station in the training room that's already set up for IV administration. This is something that is very popular in more higher competitive college football and in professional sports. All right, so heat stroke. Heat stroke is every athletic trainer's worst nightmare regarding heat illness. It is a life-threatening condition that occurs when an individual's core temperature is above 104 degrees. The individual will lose consciousness, have flushed hot skin, shallow breathing, and little to no sweating. Cold immersion is the gold standard for treatment. It is extremely important to understand that you need to cool the athlete before transportation in an ambulance. Obviously, cooling cannot happen within the ambulance itself. And then every facility should have an emergency action plan regarding this condition. It's also important to understand that the gold standard for taking a core temperature is a rectal temp. This needs to be done in private. You need to have a privacy shield in order to just mitigate any sort of issue while performing this, and normally they're flexible, so you're able to continuously get a core temperature even if you submerge them in cold water. So just be advised that if you're using any other form of temperature reading that is not a rectal temp, then those temperatures are going to be off. And so you need to understand that even if you're not getting a temperature of 104, but they're presenting with all of these symptoms, then you treat it as heat stroke. All right, so preventing heat illness is extremely important for an athletic trainer. It's critical that you push for fluid consumption and staying cool whenever possible. Communicating with coaches about having breaks for water and Gatorade and some small snacks is extremely important and needs to happen more frequently as the temperature continues to rise. Understand that as activity continues, you generally only replace 50% of the fluids that are lost. And so you need to continue to consume fluids before, after, and during exercise. All right. Fluid replacement is unfortunately a upward battle for athletic trainers. Cold drinks can be consumed rapidly, and water is absorbed and eliminated rapidly. So one of the ways to monitor this is urine color. So your urine color should be a pale yellow to indicate proper hydration levels. Anything darker than that is a symptom of dehydration. Understand that drinks with caffeine and alcohol will also promote dehydration. A good rule is for every ounce of a dehydrating drink, whether that's coffee, soda, alcohol, etc., you should drink the same amount of water in addition to the amount of water that you're already drinking every day, which a rule of thumb is half your body weight in ounces. For example, if an athlete weighs 160 pounds, they should be drinking at least 80 ounces of water a day, not including the water lost during exercise. You will need to replace that water in addition to your daily intake of water as well. And then we have this concept of gradual acclimatization. So acclimatization is extremely important for, especially in college situations, because you have athletes coming from all over the United States. And so if you have someone coming from a northern state where it's cooler or there's less humidity, and then they decide to play in a hotter state with a lot more humidity, they're going to need to acclimatize to that environment. This is where it takes 2-a-days. It's actually a concept that's actually pushed and encouraged because it allows the athlete to progress in their exposure to the climate that they're in. This normally occurs in preseason. However, during season, we do not have 7 to 10 days to acclimatize when traveling to hotter places. So hydrating prior to leaving for the trip and in the days leading up to competition is the best way to prevent heat illness in this situation. Athletic trainers need to recognize and identify individuals that are at an increased risk of fluid loss. This includes athletes who have a large muscle mass or are overweight, athletes who are at a poor fitness level, athletes who are taking medication or supplements that impair their sweating, athletes who suffer from kidney disease or have untreated diabetes are also at an increased risk of fluid loss. Anyone who presents with a febrile condition, which is an illness that causes a fever, are also at an increased risk. All right. Dressing for the temperature and humidity is extremely important. Limiting the amount of layers is important, and limiting the equipment. For instance, having a no padding practice, meaning non-contact, can be a modification to decrease the risk of heat illness. Weigh-ins can also be conducted by the athletic trainer to help monitor fluid loss, which can be helpful. A loss of 3 to 5% of their body weight can be a health threat. For example, an individual who weighs 160 pounds who loses 4.8 pounds or more is at an increased risk of a health illness. Now we have hypothermia. So hypothermia occurs when the body is losing more heat than it can produce. Cold weather causes vasoconstriction, thus decreasing the amount of oxygen and nutrients delivered to the muscles, which can also cause muscular fatigue and exhaustion. Shivering can start at a core temperature of 97 to 96 degrees and will continue until 85 to 90 degrees, varying in each individual. Brain activity significantly decreases after 85 degrees or lower. Death is imminent when temp falls below 77 degrees. We have a couple of different cold disorders. The first one is frostnip. It's a milder cold illness, which occurs in areas that aren't always protected by against the elements. It is relatively painless and will present in the skin as redness and may start peeling or blistering. It's important to not rub the area as a treatment because it can cause more damage to the tissue. Then we have frostbite. Frostbite can be divided into superficial and deep frostbite. Superficial frostbite appears pale and waxy, and when rewarming, a burning sensation can occur. It's actually really common. It is important for both of these forms of frostbite to gradually rewarm. Deep frostbite requires hospitalization, with severe frostbite developing gangrene, where debridement of the tissue is required, or in some cases, amputation. These are just some pictures of frostnip and frostbite. All right. Overexposure to the sun. It's important for all individuals that are in the sun to have protection against the UV exposure. This can prevent sunburns and also decrease the risk of premature aging and skin cancer. I will enforce here that if you are an athletic trainer, 9 times out of 10, you're more focused on your athletes than you are yourself. Understand that if you are in the sun, your coaches are in the sun, managers are in the sun, etc. So everyone needs to have their protection against the UV exposure, not just the athletes. All right, sunscreen is able to prevent against UV radiation. The higher the SPF of the sunscreen, the longer an individual can be exposed compared to individuals without protection. You must apply it before being exposed and reapply if the skin is exposed to water or is rubbed with any type of cloth. Understand that time of day is also important. The same amount of UV exposure can happen in 1 hour at 9 a.m. that 15 minutes at 1 p.m. will produce. All right, now we have lightning and thunderstorms. There should always be an emergency action plan for lightning. Athletic trainers should relay their facility policy with referees prior to the event. The NCAA dictates that athletic trainers has the unchallengeable authority to call a delay due to lightning. This can be something that is challenging to athletic trainers at the high school level and travel leagues because sometimes referees can have this authority, with the athletic trainer only providing a recommendation, which can be extremely frustrating. In general, if there is lightning, avoiding large objects, standing water, and metal objects is recommended. If you can't get to shelter, then you should crouch into the ground or in a ditch and do not lie flat. All right. The recommendation is that activity cannot resume until 30 minutes has passed since the last lightning strike. This time restarts for every lightning strike. Lightning detectors and apps can help monitor lightning within the relative area. The flash to bang method is very useful when lightning begins to get close. The time between the flash of lightning and the bang sound it produces can be used to calculate the distance of that lightning strike. For every 5 seconds, the lightning is an additional mile away. So 5 seconds between the flash and the bang, the lightning is 1 mile away. If there is 15 seconds between the flash and bang, then the lightning is roughly 3 miles away.